3 surgeries have been done before. B, the length of the palate is too short.
The main issue is the fact that he doesn't have a columella. Done surgery for about, you can see, 2.5 inches. Just done a lot of columnar augmentation, columnar recreation.
Today is his first day after his surgery. He had a very flat nose with no columella.
धीरे धीरे इम्प्रूवमेंट होगा, एक दिन में नहीं होता इम्प्रूवमेंट, क्योंकि मसल में सर्जरी किया है ना. तो ये जो आप देख रहे हैं, आपको कितने सर्जरी हुआ अभी तक? 3 surgeries have been done before, and what we're going to do today is majorly a speech surgery and also a nose surgery. Open your mouth. Say ha. I hope you can see that. Ha. So A, he doesn't have a uvula. Ha. B, the length of the palate is too short and it's not moving and attaching itself or touching itself at the base of the pharynx. So we're going to be working on this velopharyngeal movement, improving the velopharyngeal incompetence or making it more competent, or reducing the velopharyngeal incompetence, improving the velopharyngeal competence by way of muscle surgery. It's going to be 2 surgeries in one for him. For the speech surgery, we've planned to do a modified double opposing furloughs plus a sphincter pharyngoplasty, just to reduce the opening and also to take the muscles behind. Right. Now we move on to the nose. So the main issue with the nose, he has a very rudimentary small nasal bone, but the real problem is the columella. So we'll have to do a columella reconstruction, partly from this side, partly from the lip, so that we can lift it up to a great extent, to whatever extent we can. That's the most challenging part. Once we get the soft tissue, then we're also going to be getting some support from the septum in order to get the projection of the nose. Right? That's the plan for him. This might take about 4 hours. It's a pretty challenging one. A lot of scars on the nose. So we're going to expect little slow progress. Thank you.
हम गुजरात से आए हैं और हमको पूरा विश्वास है कि रिजल्ट अच्छा आएगा और हम बहुत एक्साइटमेंट है ये ऑपरेशन को लेके.
About to start this reconstructive nose job. He's already had 3 surgeries done before, different hospitals in the north of this country. The main issue is the fact that he doesn't have a columella. So we'll try and do a columella reconstruction for him. Please raise பண்ணுங்க. So what you're seeing here is an extended modified furloughs palatoplasty with a variant of the sphincter palatoplasty as well. Sorry, sphincter pharyngoplasty. So we've done surgery for about, you can see, 2.5 inches. And this is going to improve this patient's speech significantly. He needs speech therapy for a few months after 4 weeks. Just done a lot of columnar augmentation, columnar recreation. And I'm going to show you the before as well. I'm going to show the side view. It's got a pretty nice profile into what it was. Look at that. It's totally flat. This is what we've got right now. And I'm going to show the columella. Yeah, there is some amount of asymmetry, but he had no columella, as you can see.
How are you feeling now? Good? Better? Any doubts, complaints? Blood. Removal one. We'll remove tomorrow and put a new one. Okay? So today is his first day after his surgery. He had a very flat nose with no columella. So we have done a reconstructive rhinoplasty for him. We have constructed his columella, and he's feeling better today. And we have also done speech surgery for him. This is secondary cleft nasal deformity. You're feeling better. So this is his second day after his surgery. So we have done nose job for him. We have done columella reconstruction. He's a secondary cleft deformity case of rhinoplasty. So we have done this, and he's fine. How are you? Fine. You having adequate fluids, juice? All good? Okay. So we have also done speech surgery for him. That is the reason he's not able to speak now. Yeah.
Okay, that's fine.
The posterior part of the furrows is intact, but the extension is...
Nose. How many days over now?
Today is 5th day.
Put the thing again. Yeah.
Okay.
Softetul again, and this tape also again.
Okay.
And he has to get IV antibiotics for 5 more days.
5 more. Okay, I will.
Full days.
Keep him here or is it?
He'll go and come. What was he getting so far? Pep test from today onwards for another 5 days.
Okay.
Yeah, everything is okay. You have to get antibiotics now. Still 5 more days. नहीं आ रही आवाज? बात करो. बोलो. 1, 2, बस आ जाएगा आवाज. धीरे धीरे इंप्रूवमेंट होगा. एक दिन में नहीं होता इंप्रूवमेंट, क्योंकि मसल में सर्जरी किया है ना. आप टेंशन मत लो, वेट करो, सही हो जाएगा. आपका नाक का ज्यादा रिस्क है, अंदर रिस्क नहीं है, क्योंकि इसमें जो मैंने हड्डी लगाया है वो 10 दिन तक या 15 दिन तक इन्फेक्शन होने का चांस है, इसलिए हम आपको वापस इंजेक्शन दे रहे हैं. वो बहुत ध्यान से देख लो. बहुत डिफिकल्ट था ना, कि ऑलमोस्ट इम्पॉसिबल है वापस करने के लिए.